In this session, we are going to look at how you can prevent the transmission of HIV. Education and knowledge is the key to preventing the transmission of HIV. There are several ways in which you can assist in preventing the transmission of HIV. Avoiding sharing needles, syringes, or other injecting equipment. Taking precautions if you are a healthcare worker, such as wearing protection like gloves and goggles, washing hands after contact with blood and other bodily fluids, and safely disposing of sharp equipment. Taking HIV treatment if you are a new or expectant mother living with HIV will reduce the risk of passing HIV to your baby during pregnancy, childbirth, and breastfeeding. Asking your healthcare professional if the blood product you are receiving, for example, in a blood transfusion, organ or tissue transplants, asking whether it has been tested for HIV. In some specific situations, medications can be used to lower the chance of HIV infection. Reduce your risk of HIV by getting a voluntary medical male circumcision. Practicing safe sex is an important part of HIV prevention, as HIV is most often spread through sexual contact. One of the reasons why HIV is spreading so fast is that many people do not want to talk about sex. The key here is communication. You should have open discussions about having an HIV test, using condoms, being faithful, and the dangers of unsafe sex. Discussion about sex and relationships with your partner needs to happen if you are going to protect yourself from HIV. HIV/AIDS is directly related to sexual behavior. Being in being is an awesome thing, but like anything in life, it can pose some risks. Sexual health means having consenting, pleasurable, and safe sexual experiences. It's up to you to have sex in a way that reduces the chances of having an unplanned pregnancy, getting a sexually transmitted infection, or HIV. Remember, you are in charge of your body, your health, and your decisions about sex. Let us look at less risky sexual behavior to prevent transmitting or contracting HIV. Abstinence, which means not having sex, is a 100% effective way. Taking medicine to prevent or treat HIV, using male and or female condoms, voluntary medical male circumcision, reducing your number of partners, knowing your partner's sexual history, communicate and agree with your partner or partners, being faithful to your partner or partners. Voluntary medical male circumcision, or VMMC, is listed as a method to reduce the risk of female to male HIV transmission. We know that this procedure is done for hygiene and health reasons or as part of religious or cultural traditions. In 2010, research showed that voluntary medical male circumcision can reduce the risk of female to male HIV transmission by up to 60%. This led the South African government to rapidly roll out a national VMMC program. In 2018, more than 572,000 circumcisions were compared to the 485,500 in 2015. Across the country, the VMMC program has been well received. According to the 2011 Youth Sex Survey, 78% of women prefer their partner to be circumcised. Time for reflection. Here are some questions to guide your thinking and your planning. Name ways you can avoid contracting or spreading HIV/AIDS. Give examples of behavior that carry a risk of contracting HIV/AIDS. Can you describe fears and common misunderstandings about the transmission of HIV/AIDS? What advice will you give someone when asking you about voluntary medical male circumcision?